Okay, so one more factor that affects the drug response is route of drug administrations, and we have already discussed about different routes of drug administrations, the advantages and disadvantages of each route. So obviously the routes takes a major part, especially if in which condition we need to give the drug. Especially if we need to give this drug in emergency conditions, we need to choose the drugs and expect the response accordingly. So routes stay having an important role in drug response. And obviously the parental administrations produces more rapid response and predictable drug actions comparisons to other routes, because the bioavailability would be 100%. Yes. One more examples, and an interesting example here is a example of magnesium sulfate. This MgSO4 is a one drug. It's having different actions by different routes. So if we give this MgSO4 locally, it's having hygroscopic actions. Hygroscopic actions means it decreases the edema. If we give this drug orally, it's having a purgative actions. It produces diarrhea. And if we give these drugs intravenously, it mainly decreases the convulsions, it produces CNS depressions, and hypotension, decreases the blood pressures. So, depending upon the situations and depending upon the response, we can choose the route, and there is a best example that suits here. Now, certain environmental factors also having an important role, and when you administer the drug, because there is called as circadian rhythm, where there is a particular rhythm which has been going on of different chemicals, depending upon the time. So you need to modify that system, and according to that, we can also get the responses. Environmental factors, if we talk, that exposure to insecticides, carcinogens, tobacco smoke, charcoal broiled meat, all these things will induce the metabolism, and we have already discussed those things in metabolism aspect. So this drug will induce the metabolism. These drugs will fasten the metabolism of the drug, so the drug concentration decreases rapidly. On the other hand, the timing, the corticosteroid, if we give corticosteroid single in the morning, that causes the less pituitary adrenal suppressions, because this is a normal physiological thing that early morning corticosteroid levels are a bit high. So if we take this corticosteroid during that time, it acts as normal physiological way. So less chances of adrenal suppression, that is adverse drug reactions, if we suddenly discontinue these corticosteroids. So this is how different time and environmental factor affects the response. Important factor is psychological factors, and it is very important. Here, drugs we give, we as a prescriber, if we prescribe the drugs, psychological factors, especially of the patient, is having major impact in the response of drugs. And here in psychological factors, we need to discuss about this in placebo. This is very important and frequently asked questions in Viva and in theory examinations, that what is placebo. So placebo is a kind of an inert substance which itself don't have any pharmacological actions, but it produces psychological and physiological responses. So it do not have any pharmacological action, but it produces psychological response or the physiological changes, right? So it is where it is being used. So it is used mainly in patients who actually don't need any kind of drug. Sometimes patient comes with a doctor and having a complaint of headache. We examine all the things and we see for all the aspects of headache, and still we do not find anything. And if patient still insisting a drug, so we give some vitamins or we give some medications or sugar tablets at that time. And sometimes patient feels better because of that. So that is a psychological effects, and that drug is called as placebo. So those kind of sugar tablet or sterile water injections which is being used sometimes, if nothing is being found pathological and patient is still insisting, so we need to take advantage of that psychological factors also. So in those patients, physicians where do not need an active drug, they can use these things as placebo. And in research, in clinical trials, basically we are using dummy medications. We are in clinical groups, we are doing research in two groups of patients. one group receives actual medication and one group receives this duplicate medication. So we can use this placebo drug as a duplicate medications or a dummy medications or a controlled device. We'll discuss things in evidence-based medicines, but these are the two uses where we can use this placebo. What is nocebo? Nocebo is a contradictory thing of placebo, where a drug produces positive response as a placebo. Here a drug produces negative response as a nocebo, right? So why this happens? This is again psychological, but it is contrast. If patient is having pessimistic attitude, if patient is having no trust in or no faith in medications or no faith in physicians, then this kind of negative psychodynamic effects can be produced, and that is called as nocebo. If you patient is not trusting a doctor, or patient is having no trust in medications, then those kind of negative effects can be produced, and that is called as nocebo. Pathological states. Yes, pathological states obviously affects the drug response. We'll see few of the pathological conditions and how they affect the drug response. First, let's talk about gastrointestinal diseases. Gastric conditions, obviously drug gets absorbed from the stomach and the intestine, so any gastric conditions can alter the absorption of a drugs. Here an interesting example which has been taken of celiac disease. Celiac disease is a kind of a disease where absorption of antibiotic amoxicillin is usually decreases. But another antibiotic, that is cephalexin and cotrimoxazole, increases. So there is a very specific example. In celiac disease, some antibiotic absorption increases, some antibiotic absorption decreases. And obviously some drug produces ulcers itself. That is, there are drugs called as painkillers, and there are also called as NSAIDs. So this can aggravate the peptic ulcer diseases, which are ulcers in the stomach and the intestines. So depending upon the pathological states, we need to choose the drug and expect the response. Another example of pathological condition is a liver disease. Liver is an important part where the metabolism thing has been going on. So any condition which affects the functionality of liver will alter the drug response. First of all, let's talk about drugs which are having high first pass metabolism. We already discussed, right? High first pass metabolism. If the drug is having high first pass metabolism, means the concentration of drug reaching to the actual site will decrease, and this first pass metabolism happens in liver. Now what happens if the liver is already having problem? This first pass metabolism will decrease, and now coincidentally we are having now higher concentration of drug at the site of actions. So higher bioavailability of the drugs if the liver is already having pathology and drugs is having high first pass metabolism. Serum albumin is reduced. If the liver disease is there, there are chances that protein in the blood decreases, that is serum albumin, and we know most of the drugs bind to serum albumin, especially acidic drugs. So the concentration of acidic drug increases and their toxicity increases. Prodrugs, we already discussed. Prodrugs are, as such, they are inactive, but they gets metabolized in liver first, then they become active, and then they produces their response. Now if the liver is already damaged, then this prodrug won't get into the active forms, and that affect the response of a drug. So that is an example that bacampicillin is a prodrug, and its response would be lowered if the liver is not well. If the liver is not well, there are chances that some drug produces higher side effects. Like for an examples, drugs like morphine and barbiturate, they produces more brain depression or the CNS depression if the patient is already having some liver pathology like cirrhosis. So liver disease is a very important for drug response. Some drugs like oral anticoagulants, oral anticoagulants that mainly works on the coagulant factors, and these factors are actually made in liver, and already liver is damaged. These clotting factors are already low, so there are high chances that this can produce side effects. So these are the things that you need to keep in mind. These are some of the examples. And obviously hepatotoxic drugs which actually damages the liver should be avoided, otherwise it will worsen the condition. Another important organ is the kidney. and kidney having its important role in excretion of a drug. So any pathology in kidney will directly affect the excretion of drugs, and the concentration of drug in the body will increase, and it will increase the chances of toxicities and side effects. And the obvious thing is nephrotoxic drugs. Some drugs are nephrotoxic, they itself damages the kidney. So obviously you should avoid those kind of drugs if the kidney is already has been damaged or kidney is having any pathology. So drugs like aminoglycosides, cephalexin, ethambutol, vancomycin, amphotericin B. No need to worry. All these things we will discuss in particular chapters. So these are some of the antibiotics. Majority of these are antibiotics which should be avoided if any kidney pathology is there. There are some specific drugs like thiazide diuretics. They reduces the glomerular filtration rate, and they are ineffective in renal failure and can worsen the uremia. So these are the drugs cannot be used if patient is having chances of renal failure. Especially another diuretic group, that is potassium sparing diuretic, are also contraindicated because they produces hyperkalemia, increases potassium in the body, and they produces cardiac abnormalities. So that is why diuretics like thiazide diuretics, potassium sparing diuretic, this diuretic medication should be avoided if patient is having renal failure. And if patient is having any kidney problem, the high concentration of the drug concentration increases in the body, and eventually the permeability of blood-brain barrier is also increases in the renal failure. In renal failure, the permeability of blood-brain barrier increases, and we have already discussed it's a barrier which prevents the exposure of a drug to the brain. And the permeability, if the permeability decreases of that barrier, then more drugs can go into the brain and produces more side effects. So kidney failure or any kidney function abnormality affects the drug response. Another important organ is a heart. So three important organs we have all discussed, that is kidney, liver and heart. We have also seen about stomach conditions. Heart having its important role, and if there is especially heart failure, a congestive heart failure, it's a condition where all congestion thing will happen. There would be more fluid retention, patient would be having edema of the body, so fluid goes inside every organ. So there would be chances of mucosal edema as well. All the mucosa which gets edematous, so obviously the drug absorption occurs through gastrointestinal tract mucosa, so absorption will affect. There would be lower absorption of drug from the stomach and intestinal mucosa. More water inside the body because of the edema, and that will affect the volume of distribution of many drugs. So volume of distributions can increases of some of the drugs because of this fluid expansion. Because of this fluid expansion, some organ gets lower blood flow, especially kidney, because of the congestion of liver or reduced glomerular filtration or decreased perfusions. Kidney and liver won't eventually able to work, and that will eventually affect the drug response. Decompensated heart means the heart is not well, heart is not able to functional property, that makes it more sensitive to the drugs like digitalis. So response of drugs like digitalis increases. This is an examples. So this is how congestive heart failure affects or alters the response of a drug. Thyroid is again an important organ. In hypothyroidism, the patients with hypothyroidisms, they are more sensitive to the action of digoxin, morphine and CNS depression. So in those patients of hypothyroid, you need to use these drugs very cautiously because patients are more sensitive, so dose should be reduced. And in hyperthyroid patients with hyperthyroidism, there are more chances of arrhythmia with digoxin. So if you are prescribing those drugs, depending upon hyperthyroidism or hyperthyroidism, you need to change the dose. There are some other pathological states as well. For an example, antipyretics means drugs which is being used to decrease the body temperature. They only work when the temperature is raised. I mean, they do not decrease the normal temperature. So patient do not go into hypothermia if the temperature is normal. They only work when the temperature is higher. So their role is basically to decrease the temperature from high to the normal level, not from the normal to lower levels. In patients of edema, Thiazide diuretics will work better, so they produces more diuresis. In patients with myocardial infarctions, they are more prone for adrenaline and digitalis induced arrhythmia because of these conditions called as infarction. So infarctions, there is more depolarized tissue. We'll talk about this in later. Because of these more depolarized tissues, there are more chances of cardiac arrhythmias with drugs like adrenaline and digitalis. Condition called as myasthenia gravis, which affects the muscles and where muscle becomes less responsive. So myasthenic patients are very sensitive to muscle relaxant drugs like Curare, and their weakness may get aggravated by the use of drugs like quinine. So Curare is actually a muscle relaxant medication. Quinine is an anti-malarial drug, but it's having a side effects of muscle relaxation as well. So if we are using this drug in condition where there is already a relaxation of muscle and muscle is not working properly, then the condition will worse. In patient of head injury, if we use morphine, there are more chances that patient will go into the respiratory failure. So that is why it is been asked that why morphine should not be used in head injury cases. Cotrimoxazole is an antibiotic medication and produces high chances of side effects in HIV/AIDS patients. So AIDS patients are having high incidence of side effects of antibiotic medications called as cotrimoxazole. So these are some of the examples where pathological state affects the response of a drug. Other drugs, one more factor is other drugs, means if you are using the drug with other drug, there are high chances of drug-drug interactions, and that will eventually affect the response of a drug. And those interactions may be pharmacokinetic leveled interactions or pharmacodynamic levels interactions, means one drug affect the pharmacokinetic of other, means one drug might affect the absorption of other, might affect the metabolism, might affect the excretion of other drugs, or one drug may interfere with response of other drugs at receptor levels. So this is how drug interaction works, and that eventually can alter the drug response. So we need to check if the patient is taking another drug as well. If the patient is taking another drug, we need to modify the dose accordingly to expect the response. Another terminology or the factor of drug response is accumulation. As the name suggests, it's accumulation of drug in the body. But why this accumulation happen? If the rate of administration is more than the rate of elimination, then obviously drug will gradually accumulate in the body, and this accumulated drug will get deposited at the affected proteins. For an example, drugs like chloroquine. Chloroquine having high affinity for retinal tissues, so it can produce retinal damage if this drug is been used prolonged period of time. So then drug will get accumulated. Especially one more example is of digoxin. Digoxin we have already discussed in volume of distribution. This digoxin is having a high volume of distributions, and that is why we are giving loading dose of this digoxin. So it should not be given if the patient has received this within the past week. So if the patient has received this digoxin within the past week, there are still some digoxin left in the body, and still if you will give this digoxin, there are high chances it will accumulate and produce its side effects. So these are called as cumulative effects or cumulations.